Olá, boa tarde a todos e bem-vindos ao FIS 20.
Good afternoon. Welcome to everybody to FIS 2020, Rethinking Brazilian Health. Today we'll be talking about healthcare in Colombia's funding model. And then I am the chairman of Grupo Fleury. I'm going to have Dr. Vera Valente, Executive Director of FenaSaude, Dr. Rehem, Executive Superintendent of the Child's Hospital in Brazilian and Ibross, Dr. Vera Valente and Dr. Renilson. You are both most welcome. Today in our panel we have Mr. Juan Pablo Uribe, former Minister of Health of Colombia. He's going to be our keynote speaker. He is most welcome. It's a pleasure and an honor to have you here today. At the end of Minister Uribe's talk, we are going to go on to the Q&A session. Without further ado, we give the floor to Minister Uribe. Please, Minister, you may start.
Muchas gracias. ¿Me escuchan? ¿Sí me pueden oír?
Thank you very much. Can you hear me well? I think there's a delay. Everyone is listening. Okay, I would like to thank everyone for the invitation, for being here. And I promise I will be brief, and I would like to say that unfortunately the times and everything we've been going through, and I hope that very soon we'll be able to overcome everything and we can have all this conversation live in person. So I'm going to be very brief, and then I'm not going to give you a very detailed description of the Colombian healthcare model and all its complexities because it would take too long, but I would like to share you 3 or 5 thoughts about healthcare funding in Colombia, and I would like to invite you to make your comments afterwards. Maybe the first comment is that in Colombia, this transition to a model of competition or regulated competence, as we are going to see, has caused a drastic changing in funding from the standpoint of healthcare, and this has led to almost universal access to healthcare system with coverage that is mandatory in 97% of the population. This universal coverage for health has allowed Colombians to have greater or better access to health care services and very important financial protection, which is related to lower expenditures between 20 and 16% and a financial protection, especially to lower income households in the country. A second observation that we have had, and something that we haven't solved in full yet, but I'm going to share with you, is that universal coverage is done through funding. And so mandatory health in Colombia has 2 main components. One component is related to the allocation that we call para-tax, which is over the payroll, and then it gets to 12.5% for healthcare, and it is distributed in parts regarding the employer, employee, and they are complemented to get to the Colombians that are in the informal job market, would not report income that is sufficient and really on a poverty line, with a significant allocation of funding from the country and the government and subnational government fundings or funds. Especially departments and the municipalities. We are always discussing how is this possible to have a funding that is wide-ranging and to provide coverage that is wide-ranging and universal to the whole country. And nothing is more relevant at this COVID crisis moment we are going through, that to have this discussion, because it is precisely the payroll income and employment, formal employment income that are going down as unemployment grows, and there are more and more people requesting funds that are not related to formal employment. So somehow this first point and the COVID crisis and this complexity of funding reminds us and how the funding that used to be stable and provided as universal coverage, how much they are invested, committed, and how much we will need to review the allocations in the payroll in terms of tax efforts regarding the nation's budget. Another observation is that this is related to the progressiveness of funding that has a mechanism that is mandatory in Colombia. So this is very important, not just between healthy people and sick people, and regarding the risk between higher income and lower income households. And one point is that taxpayers give to those that are subsidized. This has been very important in this financial scheme that we have in Colombia, because once again, it protects particularly low-income populations, and they are protected from the risk of getting sick or dying. Now, one additional consideration in the case of Colombia for this discussion is related to the fact that this funding with universal coverage, which initially was based on an explicit benefit plan, and this plan detailed the services and the inputs that were covered, all of this gradually changed with the constitutional interpretation to a plan of benefits that is universal and wide-ranging, that only goes for exclusions. Exclusions are regarding everything that is experimental, whatever lacks scientific evidence. Now, as to effectiveness, everything is included in this expanded interpretation of the Constitution of rights to health care, of course, creating wider coverage and protection to the population and higher pressure on the funding. And this is very much related to the unbalance that the country oftentimes needs to solve regarding the funding of this right to health that is expanded based on interpretation of our Constitution. Now, the fourth element, if you allow me, regarding these elements, and the combined origin and the importance of solidarity within the program, and this issue for a growing plan of benefits. This is related to the quality expectations and services which are related to this population that is growing more and more, and has led us to consider financial mechanisms in Colombia. They don't need just an adjustment with regards to the risks that are even related to age, gender, geographical location of citizens, but this also needs to be assessed through mechanisms for risk adjustment, such as, for example, through a high cost account, and these differences in prevalence of diseases that have a high incidence, such as cancer, stroke, chronic kidney diseases, HIV, that frequently grow, that may offset the insurance premiums, considering not just the prevalence, but also the quality of the services provided and its management.
Once again, it's a very important topic, and I am sure it's something important to consider. All these adjustments that are required considering the expectations of better service and top quality services. Let me close with two additional reflections. We work with solidarity, with support, with a plan of benefits that had been expanding its inclusion and a constant expectations, also involving funding. And we also have a private-public participation, which is very important. Not only funding, because in ultimate analysis, there are a number of private companies that are really competitive and can create additional jobs. But also, in the case of Colombia, there is a private and public participation playing the role of service providers and insurance companies, because in Colombia, both arms of this system have developed with a very active public-private participation. Of course, there had been difficulties, but it is really important to bear in mind there are different models in terms of insurance and service provision. And of course, it needs a legal framework to support it. And this is what can really improve services. And above all, in case of the Colombian model, this is something that really helps citizens decide freely what they want to go. They can choose the insurance of their preference and also choose the service providers according to the area where they live. A private participation, but fully regulated, has been really important in Colombia to expand coverage, access, and free choice of all the subjects in Colombia. To conclude, I would like to tell all participants that the Colombian model, with these 5 key characteristics that I sum up with universal coverage, with a key support and budget, with involvement, with a plan of benefit that is providing the right of health to everyone, with constant and expectation of citizens for improved services. This is the result of public-private partnership and its active role. So as a consequence, there is the need of having a part also of great management and also inspection and control, so that there is no room for poor use, for corruption, providing us the opportunity to intervene according to our needs. This is something extremely important in the development and in the maturity of the Colombian system. The success of all this structure in the public-private sector will result from our capability as country as really having this long-term solid understanding. And once again, we have all the necessary tools to have intervention, appropriate inspection and control of all players to improve health in Colombia at large. With that, I close my general reflections, and I hope they can serve as teasers for the discussions in other countries, including Brazil, a country that we always look with much interest to learn what you've been doing in Brazil. Thank you all very much. Thank you. And I hope our remote interaction has not prevented us from sharing our ideas that may serve as food for thought. Thank you very much. Well, thank you very much, Minister Uribe. Very interesting comments. It's always good to learn more about a country which is so close to us, that has very similar challenges to ours. It's always a great opportunity to make us think about Brazilian system. In Colombia, they've been working towards providing broader coverage to all citizens. It's a challenge that we all face now with the COVID-19 crisis, which really makes all of us reduce our funding system for the public healthcare system. This is a challenge that is impacting us not only now, but tends to get even higher in upcoming years. So offering protection to people of lower income, people which are the most affected by the pandemic. And not only because of the pandemic, but also additional conditions that in a situation like that tend to get worse. How can the protection be brought to people who are facing the pandemic, but also people who have other diseases of high incidence? And this is a statistical data. For example, cancer, metabolic disease, cardiology disease, that despite the pandemic, they are still affecting people, and they will keep on being a huge challenge of funding to all of us. Concerning the expectations of citizens, inclusions and exclusion of services, whenever looking for better services, and also the public-private partnership. As a consequence, the competition for services and service providers may lead to better services, so that citizens can end up choosing what they prefer, what is the best center, leading to a system that is more satisfactory to everyone who is a user. And the government, which has a role of inspection, surveillance, control, to obtain long-term improvement and services of higher quality. Considering all these comments made by Minister Uribe, who has briefly explained how Colombia works, I would like to ask Dr. Valente to make her comments. Good afternoon. Thank you very much for the Organization Committee of FIS for inviting me. Dear Juan Pablo Uribe, Carlos Marinelli, Renilson, a friend of mine, 20 years ago, we worked together in the Ministry of Health of Brazil, and it's great to discuss this international experience of health access, especially Juan Pablo, who has a very successful experience ahead of the Ministry of Health in Colombia. In my opinion, this exchange of opinions is really important. When we are talking about funding, we have to come up with ways to find access to health with health of quality. How can we really take health to more people, to more citizens? I'm going to speak on behalf of FenaSaude. Maybe the minister does not know about it. The main purpose of FenaSaude is to discuss the expansion to health access. FenaSaude is the Federal Association of Private Healthcare Plan. We have 16 groups of different healthcare management companies that serve 40% of private market in Brazil. In Brazil, there are 23% of the population covered by private healthcare. But as Brazil is huge, we are speaking of 47 million people. If I'm not mistaken, Colombia has 50 million inhabitants. So only in private healthcare, we have almost the whole population of Colombia. There were 213 billion or $38 million in 2019 of revenues in private health. And private expenditures amounted to about 55% of the total health expenditures. To serve only 23% of the population, 55% of total health expenditures were made. Set this background, access to health is a challenge of all countries in the world, regardless of public, private, or mixed models. Exchanging experience, understanding what has worked and what has not worked is something really important. And once again, I'd like to congratulate FIS for encouraging this kind of exchange of experience. Brazil and Colombia, as we've heard in his presentation, follow WHO recommendations, which health is a right and entitled to everyone in the population. In Brazil, it's part of our constitution. Health promotion, health prevention, and treatment is a right of all Brazilians. However, we have a specific design of our healthcare system in Brazil based on creating partnerships among the private and public sector. In my opinion, the COVID-19 pandemic expanded this need of complementarity. Each patient who are seen in the private system, they end up releasing the public system for those who need exclusively of it. There is also a challenge in Colombia, which is the funding in Colombia. Here in Brazil, our public healthcare system has really coped with the pandemic, but there were chronic problems of underfunding. Annual spend per inhabitant in public system in Brazil is 1,400 real or $250, whereas the average of OECD is $4,000. So there is a huge discrepancy in this funding. In terms of budget for the federal government for next year, 38 billion reais or $6.7 million, which is less than what we had spent this year. There is a tax crisis in the country, and above all, finding complementarity between private and public system is the best way to go to somewhat minimize this very important issue of access to health, and all countries have this challenge. Another point that we failed to explore, which concerned funding, it's important to be mentioned because it impacts the cost of system and the need to have funding. I know in Colombia there is also this problem of judicialization, of going to court to obtain access to treatment, to medication, to procedures, which are not included in the lists of approved procedures, and it has a huge impact on the system and on different clinical costs, be them individual claims, which we totally understand, but it really ends up bringing a high burden to the collective group. Speaking of this group of problems, the pandemic has become a great opportunity to make some necessary transitions. Minister Uribe talked about the challenges that we have in terms of cost increase because of population aging, greater longevity, technology in health, which are costing more and more. a model which is really present and end up awarding excess utilization. So we really have to try to come up with a sustainability of the system. So added value systems, patient-centered care, primary care, focus on prevention. And I was wondering how things are in Colombia in terms of telemedicine. I think that it brings together improvement in the system, more sustainability, cost reduction, and it also reduces the need of funding the system. Everything is fully connected and intertwined to provide greater access. In Brazil and in the world, the impact of the pandemic, and in Brazil we have there had been a decrease in the number of jobs, so unemployment rate has increased, and it has put some pressure on the public system. So we are discussing the regulatory affairs to be able to create mechanisms to have more people coming into the private sector and having the complementarity between public and private. So we are prepared to a scenario of greater demand for health, less capacity on the government side, and all of that with increasing costs. The challenge is not mundane, but this exchange of experience is really important. Colombia and so many other countries. Thank you very much for the opportunity. So let us try to build up on our experiences. Thank you.
Muito obrigado, Vera.
Thank you very much for Vera, Dr. Renilson. Well, I would also like to start by thanking FIS for the invitation, for the opportunity, and the opportunity to meet my friend Vera, because we hadn't met in a while. So I would also like to set the context, as Vera said. So I am the chair of Ibross, which is the Brazilian Institute of Social Organizations in Brazil. It's the third sector in partnership with the public power, basically in managing healthcare units. This is a model that even though it's 20 years old, it is disseminated throughout Brazil, but it still lacks some improvement. And I think it's obvious we cannot go into the debate about the Colombian funding model, and we wouldn't have enough time to do that. We would need much longer. But I think that there is one point that is fundamental, and that both Minister Uribe and Vera mentioned. I think that now no one can defend a model unless it has universal access, universal coverage. It's not possible to have a position that is politically so barbaric that will say, well, people will die because they can't afford paying for a service. That's unacceptable. Half a century ago, this was not so dramatic because medicine had much fewer resources. So if technology was not available, there was no need. But today, as we have technologies that this is possible, this means that you would not give access to those people. You would be condemning those people to death, and this is unacceptable today. I think, and I wouldn't name names, but I think that there are very few governments in the world that would explicitly defend such a position. So the issue is, how can we assure the sustainability of any model in order to assure access? And I think that, especially in Brazil, there have been some, and I wouldn't dare, and even though I know a little bit about the Colombian model, I wouldn't dare talking about the Colombian model, but I would say that in Brazil there has been a certain sectarism that whatever is public and private. And oftentimes the public is confused with state-held, because sometimes the third sector is not state-held, but it's public, and sometimes private services provide public services. So I think that this is not just interesting to have this discussion with other countries, but I also think it is important to have this discussion in Brazil. We need to have this discussion in Brazil. And I would like to add another issue, which is I don't think we can separate the funding from two other aspects. The aspect of the organization of the system, because I think this is related to cost effectiveness and profitability, and more clearly talking about the Brazilian model. I think that we made a mistake in decentralizing, we lost scale, and this leads us to lose efficiency, and this is an issue that is very relevant. And in this manner, and I had the chance of having an interview, and I heard Minister Uribe talking about networks, and I think that in Brazil, in healthcare, and maybe not in other areas, but in health, we need to overcome the political administrative limits of the regions to think of regional networks, and this is fundamental. So in this manner, we need to improve the management of the system, the organization of the system, which in turn is related to what has been said. With health promotion measures, prevention, we shouldn't think just about hospitals, because that's the most expensive way of dealing with health problems. And I am the manager of a hospital. I run a hospital. I'm not against hospitals. But I think that the hospitals are the end of a line. So we should see in the case. So I think in Brazil it's more severe in the public sector. But I would dare say that in all hospital administration in Brazil, it's very amateur, there's a lot of improvisation. And in the case of public administration, this is added to tools that are absolutely impossible to attain and to assure efficiency. Public hospitals that have an under-professional management with no goals, no clarity of patient safety and quality of care. And I think that we need to get to this point. So in closing, what I want to say is that, yes, we do have a severe funding problem, not just in Brazil, all over the world, because more and more costs grow more and more, and there is an equation that Eugenio Vilaça always presents: growing costs with shrinking resources. And I would add that this is something that always happens. And so demands and the needs will always grow, and there is no cap. The needs are never going to stop, and resources are always going to be limited. There is no possibility of having a surplus of money in healthcare. So whenever I speak to managers, secretaries, I always say, if you think you're going to have excess money, go home, go do something else. Because money in healthcare will never be, there will never be an excess. And what I want to share with you ultimately is that we can't think just of how to obtain more money. We need to think of how to manage better the system and to manage better the facilities that provide services and hospitals. Of course, primary care is very important, but the cost of a hospital would be enough to support primary care in a certain state, and they could cover primary costs for the whole state. And so we spend a lot. Healthcare is expensive, and so in fact, it's not just thinking of more money, because there is a limit. We can take all the wealth of a country to spend everything in healthcare. That's impossible. There is a limit. So instead of thinking of funding, we need to think in the management of the system and units. And I think this is the major debate that we have today, not just during the pandemic, but also after the pandemic. Thank you very much, Dr. Rehem, and Dr. Vera, too, talking about the Brazilian system. And now giving the floor to Minister Uribe, I have a question, Minister, that Dr. Vera and Dr. Rehem have put forward. This is a challenging time, so there are limited resources and more people need it. So just talking a little bit about the Colombian experience and starting specifically through telemedicine. So it has grown a lot in Brazil, very intensely. This theme was under discussion for a very long time, and I think that the pandemic demonstrated that it is an urgent need in terms of having access, convenience, getting to people. And there was a surge, a very big growth in telemedicine in Brazil. And what do you see? Have you seen any significant changes in the Colombian system in order to be able to address this issue of limited funding and the pandemic and other needs that might be emerging now, or that you see that will emerge in the near future? Thank you very much for your question, and especially from the two persons that have commented. They have made very accurate and very valuable comments for any Latin American country and also in the global context. I would like really to praise you with regards to all the explanation, and we couldn't agree any more with your comments. I would just like to start in a more overall approach. Now, universal access to healthcare, this is going to be increasingly more demanded, more necessary, more difficult to assure, and more difficult to attain in our countries. I think that we will never get to an ideal and definitive balance for many reasons, many variables, and many issues that are going to emerge. So this is really a feeble balance that will force us to check this on a permanent way, the quality and the priority we assign to that in healthcare. And as you said, this operational model that is full of opportunity in our countries in terms of doing the best. And I truly believe in a complementation of private and public healthcare systems. And I really like the concepts of borders that we have and the frontiers, the decentralization, political, administrative decentralization, so that in order to get more appropriately to universal coverage for the population. And this is where telemedicine comes effective. For many, many years, we've been talking about telemedicine. We always talked about that technology and knowledge in order to get to faraway regions and populations that are far away that otherwise would not have access to that. So using this technology and this knowledge had been there for many years. And for many years, we saw many obstacles to do that, even though we had the tools that could help us. But it would change the financial balance, and this is very helpful to move, to get, to assure to more and more citizens and to meet their needs for universal access. So COVID, that shook everyone in a very painful way, made us understand that we could not go on delaying telemedicine. So this impact in the social program and Medicare in the US and telemedicine, the whole market and everything, this is really huge. And the way this has been changing and the way citizens relate to each other and to primary health care, and also with specialties. And I think that most of it, Carlos, will stay. And I think that the most important of everything is that telemedicine and the pandemic has shown us that these tools, if they are used in appropriate and responsible way without any abuse, any distortions, and understanding this cultural element of citizens that you have seen and the concerns and professionals that interact, and the importance of respect, secrecy, and of course the quality. And all these are tools that really help us to do this in the best way. And this is very significant. We're not going to go back. And so the resistance, skepticism, we are going to add learning. And in the future, this model will permanently improve. And there's not just one model of intervention, but it can't be a 100% hospital-based model that doesn't think of well-being and risk management. No. Telemedicine will once again be part of this necessary balance, and it will no longer be a fragile balance, and we are going to use it to benefit everybody and to have all the benefits. And you're going to shut our doors to abuses, to everything that had not made it possible for us to do it as we had been doing.
Thank you very much for your comments. Even though we still have the distance and the language barrier, but we still have a reality very close to what is experienced in Colombia. Let me ask to you, Vera, because we are here talking about models and realities which are very similar, and models that have its own funding models and public and private partnership that has to be complemented and integrated. And states and governments such as those that have challenges, such as Brazil and Colombia, can really try to be as precise as possible and offer the best quality to its citizens. We are going through the moment of the pandemic, as Minister Uribe said. We have been forecasting an improvement in the health system. So much has changed in our daily life: digitalization, physical limitations that came to an end, and now we can interact much easily. Do you think there is still room for standardization of healthcare models? What can we do about it? And are we at the right moment to provide that and to have a more modern system for future generations? A very broad question, isn't it? I think I've tried to mention that because I think this is a very timely moment. Once again, we have the challenge of access because of employments are lost, and also the challenge of access is not only a problem of funding, it also requires reviewing models and the way we organize care management at large. All these elements that were reviewed and explored, including also the different compensation models, something that we had been talking for a while. We should focus on the value of care. Some healthcare companies have half of their cases being paid through different compensation models, which is a good way to take. And this is a very timely moment because it's bringing to the table a new way of reducing costs, organizing care, leaving this hospital based system to a different kind of system. And the pandemic has shown us we were forced to change everything. Rather than having always a hospital centered care, we can organize things differently using telemedicine. People have received important information about their health without having the need to go to a hospital. So I think everything that we've said is being even enhanced by the pandemic. So partnership, inside or outside. We've seen how important it is for healthcare management companies to interact with providers, because the procedures, for example, were all suspended, so the partnership became really important. And once again, inevitably, we have to reinforce, discuss, and discuss in a very positive way this interaction between private and public. Considering the size of our country, our population, inevitably, we always have to have a full, growing interaction between private and public. Another important thing, which is part of our schedule, some of these items also require review of regulations, but Brazilian legislation of health and private health is 20 years old. A lot has happened. It has changed the epidemiological profile, longevity, technology. Everything is fine, but it has certainly increased the cost of health. So we have to modernize the legislation so that it can accommodate also an expansion of the system, which I consider to be absolutely essential.
Excelente, obrigado, Vera.
Great, thank you.
Renilson, você falou sobre
Dr. Renilson, you've
a questão
talked
de que os
about
custos eles são crescentes,
the
os recursos
fact
vão ser
that
sempre limitados e como que a gente deveria
costs are
alinhar
increasing and
com a
resources are
eficiência
always
dessa
going to be
gestão.
limited. So
O que
how can we
seria,
have efficient
na sua
management?
opinião,
In
as
your
prioridades,
opinion,
vamos dizer aí, uma agenda
what are the
positiva
priorities,
dentro
a
desses modelos
positive
de gestão que têm que ser
agenda
melhorados
in the
no Brasil?
models of
Você poderia
management that
compartilhar
have to
conosco
be
o que
improved in
você
Brazil?
vê são as
Would you be able
prioridades
to
de uma
share
boa
with us
organização desse
what
modelo de
are the
gestão?
priorities of this new management model? I think Vera pointed out something of utmost importance: partnership. If there is one thing that it was shown to the world with the COVID pandemic was the need of partnership, of working together. No one can solve this problem alone, in isolation. We always depend on each other, whether we wear a facial mask, if I take the necessary precautions, the other does not. So we are interdependent. I think that the main challenge in healthcare in Brazil and in the world is to build this kind of partnership. It takes, first of all, trust. All the involved parties, which are not opponents, they have to build trust, so that together we can come up with alternative paths. We already know a number of things which are obvious. We need strong primary care with quality, not to save money, but rather because it would not be appropriate for a diabetic person to learn he is diabetic once he goes to an emergency department, or someone with hypertension learns about hypertension only when he has a stroke and goes to the emergency. So investment in primary care is logical, rational, and also a human act, because it means we are concerned with each other's lives. And this is absolutely key. But once again, in Brazil, everything seems to be adversary. It's not primary as opposed to tertiary care. It's primary care with its own role, then secondary care, and so on and so forth. There are many hospitals in Brazil which are not hospitals. They are places that do not provide good care to the population and cost a lot. This is something that deserves review. Or decentralization, reviewing, defining networks. Starting from the beginning, I think the key word here is partnership. It makes no sense, public and private sector building separate solutions. The only solution will result from our joint construction. We are not going to have such a wealth population that the private sector alone will work, and we will never have the possibility of having the government meet all the needs of the population. Therefore, it seems to be so obvious. Together, we have to come up with a way out. Ultimately, it depends on the survival of the population, or rather, the survival of the population depends on it. As a consequence, fewer people will die because of lack of care or because of poor quality of care. Fewer people will die because of lack of access in public and private sector. So in my opinion, the key word reinforced by the pandemic is the need to work in partnership. Wonderful, really wonderful. Thank you very much.
And thank you very much for you being very realistic and pragmatic in your analysis. So we will shortly end our panel, and I would like to give the floor to Minister Uribe for his closing remarks and a final message to all our listeners and viewers, to our audience, about the moment we're going through and what we should expect in the future, considering the pandemic, but also when we are going to grow and increase care, not just in Colombia, but also in Brazil and in many other countries, the need of universal health. So there are three messages. The first one is to thank you, Vera and Renilson, for this very interesting conversation, very provocative, and I would love to continue this conversation in the future. And thank you so very much. This is number one. Second message is a message that is more pragmatic about healthcare system and understanding that no system is perfect. Every system has its pains. The pandemic has really showed this very clearly. The pain of the healthcare system with clarity that can no longer be hidden. And the message about healthcare systems is precisely of the balance. I know it's very difficult, but we need to seek that. In modern times, finding balance in modern times is very difficult. But the most important for the healthcare system, it's essential for us to be able to advance. The COVID-19 needed or required all of that. It required health promotion, prevention. The COVID has shown us that we need specialized nurses that are specialized in intensive care for 24 hours, that are people who are frail or having a disease and required maximal attention and studying everything that was going on. So the healthcare system needs a balance between national and local governments, public and private. We really need this balance. We need a balance every day, a daily balance. And this is message number 2. And once again, we need to seek and provide this balance to healthcare systems so that they may learn, improve, and improve more and more this pursuit to serve better. And my final message is of hope. Hope in face of this situation that we are dealing with, that is so difficult, that has placed all of us in Brazil, Colombia, and all over the world. We are suffering for our loved ones. We are suffering for the future, suffering for our organizations, and we want them to get better. And we are suffering because what we are living and everything that we are going through. And I think that is in wonderful partnership. Dr. Renilson has talked about the importance of joint work and interdependence, and know that we can do things well and show to others what we are doing well, and this will affect the other. And in this manner, we'll be able to share, not just in telemedicine, but in other areas too. We are going to walk out with more solid healthcare systems, with more solidarity, more effectiveness, and more public-private participation. Thank you all very much.
Muito obrigado, ministro. Bom, encaminhamos agora então para o final do nosso
So, thank you very much. Now I would like to thank Dr. Vera for her contributions, her input, and the focus you placed on the need of modernization of our legislation. And so as you remembered well, it's been 20 years, the world has changed, Brazilian health has changed, everything has changed. The pandemic has made this increasingly more urgent for us to discuss the relationships and how we can modernize the services. Dr. Renilson, thank you very much too. It's amazing, your summary. The right word is trust. This is a system that needs trust. It needs to be managed based on trust. We know how much suspicion is destructive. It steals resources, and it leads to expenses and bureaucracy, things that we could be using much better. And I would like to thank Minister Uribe for his message of hope. It's very important for us to know and learn with our brothers in Latin America. Sometimes it sounds like challenges are different, but they're very similar in the end. We are very similar. We are very much together. We have a lot of affinity, and the challenges are very similar. So this idea exchange was very good, and thank you very much for your explanation. So now we are closing our panel. Health in Colombian funding models, healthcare in Colombian funding models. Thank you all very much, and see you soon, I hope. And I would like to thank very much the organizers of FIS 2020 for asking me to chair this very interesting panel. Thank you all very much. See you. Thank you. Good evening. Goodbye. Good evening.